Thank you so much, Bejoy, Dr. Bejoy, for joining us here today. So for those of you watching, Dr. Bejoy John Thomas is from Nyalur Clinic, and he's been practicing for over 29 years and teaching in a lot of places in India about biomimetic dentistry. Understand that you've saved a lot of people from having to do root canals, right?
Yes.
There's a whole new line, and he's a very passionate guy. We've spoken so much, and I've seen how passionate you are about your practice. And what particularly got my interest was your interest towards children. And when you told me that there's a particular day you keep just for children in the clinic,
True.
right?
Yes.
And that was very interesting. And so, Dr. Bejoy, I would like to understand why would you keep a specific day for children, and what's different when it comes to children compared to adults?
Basically, when you look into the adult situation, they have 20 teeth, while the adult will have 32 teeth. Every child who wants to see the world will obviously take their parents as role model. So what would happen is, if at all the parent, him or herself, the mother, the father, the little bit skeptical, scared about dentist, then the child would grasp that expression from a parent. So let's say when we touch a flame, you would say, ah. The same thing the child is explaining, that if I am going to touch that flame, I will get a pain.
Correct.
Similarly, every parent, it's not parent, everybody will have some childhood experience which has caused a lot of trauma in their lives. And the worst thing that they come across is the pain of a vaccination. So injection,
Yeah.
pain of a vaccination. What would happen is, they will correlate that pain when they come to a dentist. How is like, parents will tell the child, if you don't have food today, I will take you to a doctor and I will give you an injection. So the child sees injection as a punishment, and he will always remember that a white coat is a person, or a nurse is a person who's going to give you injection, and that itself will instill trauma. That's the first and foremost thing. The second thing is, when they come into a dental clinic, they will be seeing lights. And when you're on a chair, you see huge lights coming in, and then you have 2-3 hands coming in. So they would feel that, okay, I'm going to go for a punishment by the parent. So most important thing a parent should do is, first, when they want to bring a child to a dental clinic, it is always better to show the child, okay, this is an environment where it's so safe. He is my friend. So introduce the dentist as a friend. Bring the child along, not for a treatment, but bring the child along with when you want to go through a treatment. And so what would happen is, the child always relates, my mother, my father is a role model. So he will always be looking at the doctor working on his father or the mother. And that experience itself will give him a confidence. So it may not be very easy to, because most of the kids are totally afraid of a dental clinic. So it may not be very easy. So what would happen is, if the treatment has to go for a 1 sitting or a 2 sitting, bring the child along. Let him come and see the field.
The parents
should bring the child to the clinic along.
So they get to see this is a natural.
Yeah,
this is a natural setting.
Yeah,
it happens.
it happens.
My mom and dad go through it. They're fine.
Yeah.
So then they get to relate to saying, hey, this is something usual. The same is going to happen with me. So otherwise it becomes like this horrific experience. And I remember growing up, sometimes they would say, hey, if you don't brush your teeth, no, I'll take you to the dentist.
True.
And so the day you land up at the dentist, you're like, totally, it has become, I have arrived at my judgment.
Not only that, even if it's the parent part also, they would say at home, oh, I had a very bad experience at a dentist. And or they would say that, I had a terrific pain after treatment. So these things are immediately grasped by a small child who is going to see the world through you.
Correct.
So your facial expression is very important. The second thing what would happen is, as parents, we will somehow find time to get the child to the clinic. And we will be taking an off. When we take an off, or we would be taking a half day leave. Or we would be in between, we will be rushing out of the office to go back in. So we were at our toes. That time is a constraint. But we never look into the the child would be having a cold or a fever or some irritable situation where he will not sit tight. So these are some of the few things which puts the child into the trauma. Like if the child is having a cold, a simple cold is enough not to breathe. And you cannot breathe through your mouth when you are on a dental chair, because in a dental chair there's a lot of water and air coming into your mouth. So you would expect already your child is having a cold and he or she is breathing through the mouth. At the same time, you are asking the child on a dental chair, please breathe through the nose. It is already blocked. Literally the child will be crying. And it will be so
It's a practical challenge, isn't
practical challenge. And parents don't look into these things. So they somehow want to get these things done. I would say get a dentist who you feel is like a friend of you, who's got time for you, and never rush a treatment. On the first day, it should be very smooth. Show him on the dental chair, the chair will go up, the chair will go back. There's a light coming, going. There'll be air coming in. You can just put a little bit of air on your hand, the child's hand, or maybe a little of water, maybe spray something. So he himself will see, okay, this is not painful.
This is very natural.
It's very natural.
Relatable. They get to experience, these are just other equipment in a sense. Yeah, I think just to catch up, you've the gems of pointers coming out. I think just to summarize in a sense, or just to capture what has come so far. So you're saying one is building a positive narrative, right?
Yes.
And the role of the parent in building a positive narrative around whole of say dental care, right?
True.
So what we talk about dental care, so basically not demonizing it, right? So we don't demonize it and say, oh my god, do this, or it's not a threat. We don't use it to threaten. We don't give a negative connotation to dental care. We come in with the idea of, hey, just like we go to many spaces, we go to the salon to get ready, and we go to dental care to get our oral hygiene done. So the general conversations is one, probably. Second, what you were talking about is the idea of talking about the experience. When we narrate the experience at the dentist at home, if ever,
At home,
we build a positive conversation where we're like, oh, now my teeth's better, maybe, or now I have the pain is gone. Now my teeth is fine, or we can talk positive about dental care, so that when the day comes, they start from that point, right? They start from a building base of, oh, this is something we do, this is something that helps, right? So we look at it as a community helper in a sense, right? We talk to a lot of our students about how we look at police or firemen or all as a community helpers. I think this is a great way to put it. They're community helpers, and they help us in this way. And I think the third one you said is some practical tips, which is when planning a dentist appointment, being aware of the child's health condition. Primarily anything ear, nose, throat, ENT related. So where no congestions are there's no blockages, because when there's fluids going in, they have to be able to breathe. So far, these are a few things you've said. I think you also touched upon a very important point of injections and pain. What's the positive narrative around that? How could we build one?
See, normally at home, when you tell a child, I will get you a doctor to give injection if you don't have food. It's a threat. But actually what we have to tell the child is, see, these germs which is in your mouth, they are always active. So they are going to take the food what you have in your mouth. So that means they will take that food, they will eat themselves, and they become bigger. They build houses in your teeth, in black spaces. And then whatever supposed to go into your stomach, they are eating. So now there's a situation where, let's say, it's like a hide and seek situation. The germs will really know the doctor is coming in to check them out. So it's not going to be easy to find these germs, or it's not very easy to say, okay, I'm going to take please stay. So what we have to do is, we have to put it in a story such a way that we have to allow or give some medicine so the germs will sleep. For the germs to sleep, we will have to put some medicine into your gums. And that is the only way to take the germ out of your mouth. Otherwise, what would happen is, if we don't give you an injection type of medicine, these germs are going to bite you. The moment they bite you, you're going to have severe pain. Rather, we will make them sleep. Building a positive relation like
Oh, wow.
that would make them feel, yes, if I allow the doctor to make them sleep, they are not going to bite me. So I will never know pain. That is one of the best method to
Sweet.
tell them that
So good.
we are going to take the germs out, and we don't want to have black space. Black space in the sense, I keep telling my patients, your house, your wall, it will be always white, right? They will say yes. Do you want to make it black? No, I don't like black. So I relate that black with the germs house. So germs, what would happen is when they build their house, it will be always black in color, and they love black. And we don't want to smile with a black teeth in front of us. And people will say, "Oh, you have a black teeth in your mouth. Are you not brushing?" So instead of that, to make that black into white, we have to pull the germ out of the mouth. So the best way is to give you a small injection, and I'm so smooth that always I give bets. Betting in the sense, I keep telling child, if I give you an injection and you have pain, I would always buy you a big bar of chocolate. That itself, the crying child will have a big eyes. Oh, doctor's going to give me chocolate. But then I add one sentence below. If I don't cause pain by giving you an injection, you will have to buy me a chocolate. They would say yes. But in my experience, the last 30 years, 99% on the first day I would be telling the story. The first day itself I will be giving injections, and that's how I win them.
Yeah, I remember you saying the story to me because when we deal with children, stories are the way they it's the best way they relate to a situation. In the concepts form better when it is story, and
They
that's
love to hear stories, and always in the mother, if they want to feed their child, they will be giving small stories. And when a doctor or a new person starts telling stories, they will always hear this.
They listen
And if the parent is standing just next to you, more effective. Like, see, the parent will always find it very difficult to feed the child. So he can or she can tell him this story. Yes, you went to that dentist. Didn't he tell you that this is the problem? When you have food, you have to chew it properly, and after each food, you have to wash your mouth. You have to brush your teeth. All these stories, when the doctor tells to the child, he puts in such a manner, he brings down to a 3-year-old, 4-year-old level, because it's not going to be easy to tell the child on the way we speak to adults. So I think a narrative manner or any small procedure,
nice.
Giving a tell, do, show technique. You first you tell, then you show, and then you do.
Nice.
So end of the day, they accept the procedure.
Great. Yeah. So I think touching upon a few of maybe could you give us top 3 things that parents could remember in what we like, maybe in building a routine or in a general sense. Say what are the top 3 things that would be helpful for a child to in terms of, now we were talking about dental care earlier, but in terms of everyday routines, in terms of general oral hygiene, what could be, say, top 3 things you feel we should build into our children from a young age?
See, we all say brush in the morning. And we also brush in the night. But how much are we in clear? What is the advantage of brushing in the morning? Most of us brush in the morning, but we are still not clear why we brush in the morning. We brush to my sense, I keep telling people who come to my clinic or clients, we brush our teeth in the morning is to have a good breath or
correct
for the society. But if you really want to retain your teeth in the mouth, it's absolutely necessary that you have to brush in the night. Now, the technical part for a 2-year-old, 3-year-old, the moment the teeth comes out into your oral cavity, the child has no clue. And parents tell them, and the child will be timid in saying that, yes, I will brush my teeth. So mother and father thinks that he knows everything, and they leave it off. But I would say it is always better you, the parent, assist the child in brushing in the night. And in the morning, it is not at all an important thing, because you have already cleared all the deposits which was there in the mouth just before bed. In that context, I would like to say one more thing is, We all wash our mouth after food. How many of us wash it properly? Like when we go for a party, or when we go out with some friends. I always, even wedding is the best thing, and you can take an example. We have food, and then there's a huge crowd waiting to wash.
So it'll make it fast.
So what we do is we just take 2 gulps of water, swish, and we walk off. I have a small problem. We all have a small problem there. Any food particle in the mouth after 2 minutes,
2 minutes, huh?
2 minutes becomes acid.
Oh.
So we will see our friends after having a good food, or maybe after having a chocolate, pushing their tongue here and there, trying to nudge the sweet, enjoying that sweet. But actually, what is happening, especially if they have not washed properly, in 2 minutes, this food or sweet in the mouth is going to be acid, and this acid is going to make holes in our teeth. So washing mouth is very important. And how many times should you wash? What is the amount of water you should take? We all would feel, since we have let's say our mouth is 100% volume, we would say, yes, I have 32 teeth. So water should reach all over. So what we would do? More than 50 or at least 50% of water we would take at a time to swish. Now the problem is the rest 50% is the only space which we have for the water to move.
Correct.
Now what is happening is the water will never move. So what we are supposed to, and the best example I can give you is the seashore. These rocks which we have, which we use to build for the basement of a building, are always rough. The same rock, if you go to the seashore, is smooth. It's just because water comes and hits so hard.
Correct.
Splashes. So that's called velocity. Water comes and hits. The same manner, when you take a little amount of water at a time to wash, let's say it's 30%, 70% area is the movement of water. So then when there's more movement, all this dirt comes off. And it's not like 1 or 2. It starts from 4.
Okay.
Nothing less than 4. We have to make
4
it times you have to take to wash, spit.
Brushing teeth in the night was one. Next, you spoke about washing. So making sure we at least rinse
minimum 4 times.
4 times,
Minimum.
and with about 30% of
Water in your mouth.
30% of the space. So that there's more movement, and it really
30% of in the space, 30% is water.
Correct.
70% is the space for the movement of water.
Got it.
This is one thing which people don't understand.
Yeah.
And off late, because I've been practicing the last 30 years, I just recently I came across a group of the Maldivians. I was like shocked. They never have the habit of washing mouth.
Okay.
That could be one reason why every Maldivian have a tooth issue.
Oh.
Every Maldivian. So for them, washing mouth is never in their criteria, and only once they brush, that's in the morning. So always they are having a lot of bacteria in their mouth acting on their teeth. And for information, there are good bacteria and bad bacteria. So in the morning, when you are going to brush your teeth, you are going to come across bad bacteria which just produce that foul smell. In that scenario, if you do it properly, then this bad bacteria is not going to go into your stomach.
Okay.
But actually, if you have done it in the night, bacteria, you cannot tell them. You cannot move to that space, you cannot move to this space. When there is food in your mouth, the bacteria is going to act, and they're going right down to your gut and back to your mouth. So there's a free movement.
Yeah.
So brushing is important in the night.
Yeah. Washing.
The amount of water you take is very important. When you want to change a brush, or when you want to go to you tell the child you have to use a toothbrush to brush. It's always better. Take him along to a supermarket. Show him, okay, these are the kind of brushes there. There could be some fancy brushes. If he says, okay, I would want to have a brush, you can do a barter system. Yes, I will buy a brush for you, but allow me to help you in the night.
Correct.
So that you can use it in the morning on your own. So that is one way of taking a child,
getting them
into the process.
Yeah.
Because most of the time, what happens is when you take a paste on a brush, they would want to eat it. They just gulp it. Sweet. And then there's nothing on the toothbrush. That also can be overcome.
Okay.
It's a very simple way. In the morning, you take up, in the morning or the night, you just wet your brush to a child in front of him, and you have to wet it in front of him, and then take a little piece of paste onto the toothbrush, wash your finger, and just press it.
Press it in.
So what would happen? The whole paste will go down in between the bristle. How much ever he brushes his teeth, nothing is going to go waste. At the same time, for minimum 1 to 2 minutes, there is enough paste between the bristles.
Wow, that's some great insights there, some great tips, I think, for us to remember. I think some things for us to take home as adults also.
Yes.
Maybe that's a big part of just modeling it, right?
Yes.
Modeling it for our children
Yeah.
and carrying that, keeping these things in mind. Well, that's really interesting. I think it's really early on. I think we start to build these positive narratives and routines. I think it really helps, and maybe also helps for children to know why. Right,
Yes, yes.
to have these stories and have these narratives. So because children today, I mean, children are more and more. Children want a reason,
Yes,
want meaning
children,
behind
yes.
what they do, and I think this is a great way to do that.
It's not only children, any treatment before we do as a doctor, we should justify. There's something called patient right. The patient should have the right to know any treatment. So if we can build this in a small age, obviously when they grow up and when they go to different countries, they will always have a positive thing in their mind. Yes, my doctor at home, he gave me all these things. So you don't tend to go into the wrong treatment plan. Or and because there's a relation between a doctor and yourself, any part of the world, they'll give a call to that first doctor. Doctor, I have an issue. Can you help me? This is what they say. So that friend, as a dentist friend, is very important.
Great. And I think also that, so you're saying it's important to understand what's going on and why.
Yes.
So in future, when they are in a situation where they have to make a choice, they will again ask questions and try to understand. And so they'll make better decisions in terms of understanding how whatever treatment is being done. Like, that's a great point. Wow. That's super.
And we have a culture in Kerala. Is we are all taught not to take cold water. If we take cold water, we have a sore throat. For the information of all, including you, see, when we take a little cold water into our mouth, and if we have a defect, a small crack, a small hole, or anything related to tooth issues, we will have a shock. So that is not pain. That is only sensitivity. Where you have lost your enamel and that problem has hindered the dentine.
Yeah.
Now, because it is cold, we would not want our child to take cold. So what I would tell is, take a little of cold water in between and swish. So if you have a jolt, that means you have to go and see a dentist. But you could repeat that after 2 days. Again, if the same thing persists, you go to a dentist, tell him you are sensitive to cold. Normally what happens is, the patient will come to the clinic, say, doctor, I couldn't sleep, I had severe pain. Now the doctor, if he does not have time, the immediate treatment plan would be to do a root canal. So when will a root canal happen? It's very simple. When you take a hot coffee, hot water, and you have pain. When you are sleeping in the night on the bed, you have pain. When you have a toothache which lasts minimum 3 to 4 minutes, then you literally have a severe issue. Otherwise,
it is sensitivity.
It's just sensitivity. And please remember, do not use sensitivity paste also. In our country, sensitivity paste is not recommended. I would say why is because if you go to the West, most of the time it is cold. And the normal pipe water coming to the pipe is cold. And if your family has got a lot of tooth decay, every time you put that cold water into your mouth, you're going to have sensitivity. At that time, to get a dentist is difficult. You will, there are a lot of countries we have to wait 6 months. So 6 months waiting is going to be terrible. So at that time, this sensitivity paste will help. But in a country like us, we are a tropical country. The pipe water is not cold; it's just normal water. And when you put it into your mouth, if you will never have sensitivity. In that scenario, if you have tooth decay where you are supposed to have sensitivity and you use a sensitive paste, you will never have a problem. Your problem gets masked, and when will you come to a dentist? at the last moment when you cannot
So as the enamel gets affected, it is basically eating in, but you're not knowing.
Yes, it's not the enamel, the next layer. Enamel is
Oh,
very hard. It's
okay.
the hardest substance in human body.
Okay.
Even the drills which we use are small diamond bits.
Okay.
So the next layer is the most crucial, called dentine. This is the sensitive part. So if there's a new dentistry now in the world where we can mimic all enamel and dentine.
Okay.
And so that we don't have to do a root canal. But there are scenarios where we literally have to do root canal. But if we can mimic the structure which is lost, I'm sure your tooth will last a long time.
Ah, right. Thank you so much, Dr. Bejoy. I think we've covered a lot of topics, and I'm sure people may go through this over and over again to get through certain points. But great, super insights, and looking forward to continuing to keep this conversation alive. Thank you so much.
Thank you.